Hello and welcome. Today we are talking about PID, a common yet serious infection that affects the female reproductive organ. PID is basically the short form of Pelvic Inflammatory Disease. PID, it can lead to long-term, short-term health problems if not treated properly. So its understanding is usually crucial. So I'm going to give you a few tips of the causes and signs and symptoms and ways you can use to treat PID. It usually begins when bacteria, often from sexually transmitted infections such as gonorrhea and chlamydia, and also other bacterial infections such as the bacterial vaginosis and trichomoniasis. When these bacteria travel upwards from the vagina to the uterus, fallopian tube, and ovaries, they cause some bloating. That's actually the most common causes of pelvic inflammatory disease. The symptoms of PID can vary from one person to another. They vary oftenly. So they include low abdominal pain, vaginal discharge, painful urination, pain during sexual intercourse. Then sometimes it can have no symptoms. So you get that this one is usually very complicated because most of the time it will go unrecognized or undiagnosed because if you don't have symptoms, most of the people won't go to hospital because they won't see any side effects. If you experience these symptoms, it's important to see a healthcare provider as soon as possible. Undetected pelvic inflammatory disease can cause complications like pain, as we said, abdominal pain, infertility, or ectopic pregnancy. The good news is that pelvic inflammatory disease can be treated with antibiotics, and usually they combine different antibiotics. So if caught early, most women can go to hospitals or chemists or pharmacies and they'll be prescribed a combination of 2 antibiotics. For example, you can be given a combination of metronidazole and clindamycin for 14 days. In severe cases, injectable antibiotics can be given. In cases infection causes abscesses, these are growths, surgery may be required to remove the infected tissue. To reduce the risk of pelvic inflammatory disease, you should practice safe sexual practices such as using condoms, get regular STI screenings, you go for urinalysis tests, pap smear tests, properly treating of sexually transmitted diseases and urinary tract infection, so to prevent the long-term complications. If you have PID, don't be hesitant to seek medical attention. Do not feel shame when you're going to the hospital. Talk to your healthcare provider and know you are not alone in this fight. Please follow, like, share, comment, and subscribe to get more informative content about your health.